Good morning, guys. My name is Dr. Cade, and I am here with Coach Cason, and today we're going to talk kids probiotics. It's such a big topic because, Cason, as we talked about in our adult probiotic video, we are more bugs than we are human.
10 to 1.
10 to 1. Oh, it is wild. It is wild. So we're going to talk about some awesome products today. We're going to talk about probiotic usage for kids. We're going to really try to clear up some of the confusion and talk about what's the best products are out there and what they're going to do for you. So why don't we just start there, I suppose. Let's talk a little bit about symptoms, why somebody would want to be using these probiotics and products. And then why don't we talk about the things that can really kind of set us off and put us in a bad position. Cool. And then we'll jump through our favorites. Fair enough?
Yep.
All right. So when we talk about probiotics, why would it be an important thing to use for your family? Well, a lot of the things that we see with kids, all the way starting from the beginning, is colicky. Yeah. Colicky kids, fussy kids, tummies that are just tough, whiny kids, kids that are spitting up quite a bit, right? And we see our fair share of that here in the practice, but other things may include eczema and skin issues. You know, as the kids get a little bit older, trying to hit and make sure that we're staying on track with some developmental milestones, maybe speaking, maybe behavior, maybe falling asleep and staying asleep. Maybe you're dealing with some of those issues with your kid.
Yeah.
Anything else?
Well, my mind goes right to toddler stage, you know, and behavior issues.
Yeah.
And we just see this, you know, ADD, ADHD, all these diagnoses is thrown out, and the kids just don't seem to have focus. They don't seem to have, proper behavior. I don't know what that means, proper behavior, but they're all over the place, high, low, and so, yeah, a lot of that goes back to the gut.
It does. You know, parenting is a big part of that too, which we'll stay away from today since we're still learning every single day. And sleep plays a big role in that, but 100% the health of the gut is going to dictate the health of the brain. In Cason talk about mood, anxiety, anxiousness. We talked about, or I don't think we did yet, but immune system is another big part of it. Allergies and asthma and skin sensitivities. Yep. You know, so probiotics are so important. And if you want to learn a little bit more about the adult side of things, you can watch that video there. But specifically for kids, what is really some of the big reasons that kids are being put in this position? Well, right, it starts from birth, right? Yeah. And the most important dose of probiotics that we can ever get is from a natural vaginal birth. And those rates seem to be going down more than ever these days. C-sections are up, and it just isn't the same. But it can even start before birth, can't it?
Sure, I think mom is where it comes from, right?
Yep.
And dad, but mom primarily. And so what mom is eating, the antibiotics that mom's been on in her life have everything to do with her gut flora.
Yep.
And so, not to mention, the toxic standard American diet. So there's a lot there.
It starts so far back. So ideally, if you're looking at probiotics for your child, I wish that we would have met you, in the preconception kind of phase to get these things handled and done the right way. But last thing I want to touch on before we jump into probiotics, one of the most important things that you hear after birth is again, that skin-to-skin contact, where we're transferring the bacteria from dad and from mom and giving that to baby, again, for baby to just thrive. Immune system, brain, gut, all the above. So let's jump into products. So we're going to start with the first one of baby, and this is the gold standard within the industry, is this Klaire Lab. They just actually renamed it. We used to call it infant probiotics, but now it's baby probiotics. And so in there, it's a powder. It's 5 billion CFUs. You got to keep it refrigerated. That stuff is unfortunately pretty fragile. But when we give it to baby, what do we always like to say? There's a spoon in there, and you just dump that spoon right in the palm of your hand, and you can just put your pinky finger right in baby's mouth to take it right off your finger. That stuff is great, and typically we recommend starting that immediately, right? And if there is a great gut health from mom that's transferred down, if there's other issues, again, like colic and some of the things that we brought up, or skin issues, then we'll dose up. So it really just depends, baby to baby, family to family. So.
Interesting. That's so cool. I don't know what you know about these babies, but how you get that probiotic into the baby is it takes some creativity.
It takes creativity. That's a great way to put it, but mostly just trial and error. We have tried to feel like a little bit of everything with our own kids with that one. So let's jump up. We're going to get a little bit older, and now we're going to move to tablets. And so this is from the same lab, from Klaire's lab. This also needs to be refrigerated, but these are like chewable tablets. And we like to recommend that kids get on this one as fast as possible after the powder that we just talked about. And the reason why is that there's a huge jump from 5 billion CFUs, again, the strength, the potency, see how many numbers of bacteria are in there, all the way up to 25 billion.
Wow.
So big jump, and the price is pretty much about the same, right? And they're easily crushable. So if you can kind of crush that tablet, I feel like you're getting more bang for your buck, right?
Yeah. Hey, just to back up, a quick question. So the baby CFU unit is lower
It is.
the kids?
5 billion versus 25 billion.
Makes sense. As they're growing, getting more bacteria, you're upping it.
Absolutely, and exposed to more stuff too as they get a little bit older, right?
Cool.
So those are kind of the two gold standards for baby and then for kids, and where that line starts is a little bit blurred. We usually like to start them when they start getting teeth, and some parents like a little bit earlier, some a little bit later. And then as far as frequency of those things, again, we talked about making sure that that's individualized within the family. And then last thing is maybe a little bit of diversity before I hand it over to you. Yeah? All right, is going to be these Mega Kits. We love this brand. Microbiome Labs is just fantastic. They're innovators in the space, and this just came out. It is called Restore Flora, but again, it's their kids' version of it. And if you want to learn a little bit more about Restore Flora and the bacteria that's there, you can find it in the adult video. But that stuff's great, and then it has like passed the kid test for taste for sure.
My daughter's way picky, and she eats those like candy.
Yeah, the ingredients are clean. Like, we had them sitting up on our desk, and I think we were all snacking on them multiple times a day. So
delicious.
There's maybe your warning. You'll just go through them fast. That's the downside, but you will certainly be full of good bacteria. So I lied. I'm going to go through one more. And this one is actually from the same brands. This is from Microbiome Labs. And these are almost like Starburst chews. This is another one that really passed the kid test, and I think definitely passed the adult test too. And these actually came out, again, from the same company, maybe just a month earlier. So what we always like talking about with probiotics, again, reference in the adult video, is just the diversity and rotating through your probiotics and getting different things. And it's even nicer when you don't have to fight with the kids to get them to take some of these things, right?
Yeah, and they taste good.
Yeah. Okay, well, last one's all you. Fulvic and humic acid. What do you got, Cason?
Yeah, well, we talked about this in the adult video of probiotics, but again, this is minerals. This is a wide variety of minerals. It comes from the earth, from very ancient soil. And so this is like a force field for the gut. So you can use this if you know that you're going to eat some food that's not the cleanest, or if you're not able to get your kid to eat broccoli and Brussels sprouts. This is something that will help to protect and line the gut. The gut's got this mucus barrier that is lining the enterocytes, the cell lining, and so this helps to make a shield, kind of a force field for that. They call it a probiotic. It's not really a probiotic in what it's made of, but it's minerals and energy and force field to protect and heal and seal the gut. And I think there's some really good research out there with Dr. Zach Bush. He's got a very similar product to this that shows how this product helps to heal and seal the gut. So you've probably heard of leaky gut. This product has been shown to help to seal that leaky gut. So really good stuff.
Awesome information, man. I love it. And our philosophy here, I know I speak for myself and for Coach Cason, is that we don't want you to be on this stuff forever. These are just awesome tools to help build a foundation of health for your kids. We want to make sure we're doing everything that we can to really kickstart their life. Their health is a really big part of that for the rest of their life, right? And if your kids are struggling with the things that we mentioned in the beginning, food sensitivities, allergies, asthma, ADD, whatever other labels are coming up, colic, we've got articles on our website, we've got videos on our YouTube channel, and if not, you can always reach out. If there isn't something that you're, if you can't find what you're looking for, just reach out. We'd always be happy to do a free 15-minute consult and just point you in the right direction, whether it's with products, whether it's with a hot pack on the tummy. I mean, that goes a long way. Whether it's some breathing exercises. You've had some amazing patient testimonials recently of just people breathing. It's as simple as that, right? And just kind of shutting some other things down. I mean, it's incredible. But we'd always be happy to do a free 15-minute consult with you. And Cason, what do you think? Anything else to say?
Well, the gut is the brain, and the brain is the gut. So when it comes to kids, I just really think about this is their development. This is how they're reaching those milestones to develop a healthy brain and a healthy gut and a healthy body. So
I love it. I love it. We can't say that enough. So thank you guys again for joining us. I am Dr. Cade, and we'll look forward to seeing you again soon.